Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by Dr. Koushik Reddy. Dr. Reddy earned his medical degree from Gandhi Medical College in Secunderabad, India. Upon completing his fellowship training at NYU's Winthrop University Hospital, Dr. Reddy joined the James Haley VA Medical Center and University of South Florida in Tampa, Florida. He's currently the director of the Cardiac Intensive Care Unit at the VA Medical Center. Dr. Reddy is the founding co-chair of 2 member interest groups, VA DoD and Cardiology, under ACLM. He's the first interventional cardiologist to be ACLM certified and to be recognized as a fellow of ACLM. He's also currently the only interventional cardiologist to be recognized as a lifestyle medicine intensivist. He served 2 terms as ACLM's treasurer and currently serves on various committees and working groups under ACLM, ACC, and ASPC. He has won many awards, including the VA's Presidential Award for Teaching Excellence. He has published numerous peer-reviewed papers on lifestyle medicine and cardiovascular disease and has spoken at multiple national and international venues. Welcome, Koushik. How are you doing today?
Wow, thank you, Padmaja, for actually doing this. I've been watching the Flip the Script episodes, and they're coming through as very valuable tools. And thank you for those kind words of introduction. And yeah, I'm doing excellent. Thank you for asking. And how have you been, Madam President?
Well, I am doing great. I'm so honored to have you here today for this conversation. So let's start our conversation by exploring your path into lifestyle medicine. I'm curious, when did you start to see lifestyle medicine as a powerful tool for preventing cardiovascular disease?
So my journey started sometime in like mid 2016 into early 2017. On a day, I specifically remember that day, on a day, what I call a routine day in the cardiac Cath Lab, after I did about 7 or 8 complex procedures, came to my desk, and the burden of writing the reports and fell on me because I didn't have fellows that day, and just mundane way of mechanically doing what I've been doing for a decade up until that time. And out of nowhere, no specific reason, a unique, not a new question, but unique to me, popped up. And I looked at all these things and I said, if I'm treating all these medical conditions, risk factors as evidence-based medicine in an academic setting, why are so many of my patients falling victims to the disease that should be controlled by all this? And I sat down for a second. I actually took a piece of paper and wrote it down on a piece of paper and said, did I get my entire paradigm wrong?
Wow.
I thought about it for a second, and my honest and sincere answer is said yes. So back then, my wife, who you know well, and she used to work for the VA, and we used to have a tagline, and I said, honey, I'm actually having an interesting day because I'm questioning my entire career path. And she said, we have a name for this. We call it midlife crisis. So that was my true personal insight into I really need to change my paradigm, but I did not have a knowledge base. I did not have an avenue. And around the same time, through a Facebook post, I had heard about American College of Lifestyle Medicine, looked it up. There was an inaugural board exam, a meeting coming up, and with like literally short window of opportunity to register. And boy, did I jump on it and showed up and attended my first conference in 2017 in Phoenix, and took the board exam the following year. And it's been since a truly fulfilling and a meaningful and a very gratifying journey. I haven't left the Cath Lab, but now it's become a mission to keep as many people as possible from as far away from two places. This office is physically right in the smack in the middle of a Cath Lab and the CCU, and
Mm-hmm.
my door tag on the front also has lifestyle medicine emblems and a carrot.
Cool. We'll come to the carrots in a minute. But what is like to be spending most of your time, just as you said, caring for patients in cardiac ICU and Cath Lab, and then still push forward this message of lifestyle medicine and prevention? How do you do that?
Yeah, so it is a phenomenally great question, and I actually posed that question to myself and to my patients and my colleagues. Is that it's an art fit for the likes of me who spends most of his time in training and training others and doing procedures in what I call the deep dungeons of a lead-shielded cardiac cath lab, to step outside the confines of that space and make a humble plea first to myself, personally and professionally, and to the whole world now, is to don't meet me there. It's what drives me to do that is that data is that solid.
Mm-hmm.
That's the only driver. I have nothing else drives me because I'm in the full-time academics, and then the mission is how to passionately communicate it to professionals and lay people so they see the value in it. Because 80 to 85% of what I do in both of these places, cardiac intensive care unit and the cardiac cath lab, is preventable.
Mm-hmm.
Even sometimes, events are preventable even when the disease is advanced. So that's my driver, and I have fun with it. I've gotten fairly good at communicating that message,
Yes.
in a passionate, in a non-judgmental way when it comes to patients and their families.
Yeah. So we've all heard you talk about carrots and stents. And what's the story behind your carrots?
So the story behind carrots is, since I just passingly mentioned about my inaugural attendance and to ACLM. I'm a newbie. I don't know the college. I don't know the people. I don't know the leaders. I'm just sitting in the audience, and like, first I'm joyful that, wow, there is my tribe. There's a world out there like this. And
Mm-hmm.
as we still have it at the college, every day of the meeting there is a designated keynote speaker.
Right.
And day number 2 or day number 3, keynote speaker was John Mackey. And that was
Mm-hmm.
weeks or months after he sold his company, Whole Foods, to Amazon for a few $1 billion. And he's in great spirits. And I was sitting there in awe, asking only one question: how does a grocery chain store owner know so much about interventional cardiology?
Wow.
His entire talk was about how majority of the PCIs are being done inappropriately. They're not following what we call appropriate use criteria. And he was not showing pictures of fruits and vegetables. He's showing pictures of slides from JACC, Lancet, and cardiology journals.
Wow.
Wow, this is like a chair of a cardiac cath lab speaking. And then, as luck would have it, during Q&A, I raised my hand. Susan Benegas, who did not know me from Timbuktu, she hands me the mic. And then I was just, hey, look, I agree with you, but there are the likes of me who are interventional cardiologists who are in the deep trenches of a cath lab, but here to basically pass on the message that I didn't even rehearse those sentences. It just flew out of my mouth.
Came out.
That I have a carrot and a stent you pick. And now that's, over the course of years, kind of became my, identity kind of thing. Now I go to ACLM, people walk by me and say, we'll take your carrot, Koushik. So that's kind of a nutshell story where that came from. Yeah.
It's a powerful message, and I think it really conveys what you are trying to communicate effectively. So it's a good message, a good tagline. So how did you end up starting the first lifestyle medicine shared medical appointment for cardiology in the VA system, which is kind of unheard of? We've seen in primary care. And what does that look like in your practice?
So very early on, what had happened was that I felt the need to actually have a medium where I can get this message to more people than the ones who are meeting me in the cath lab or the CCU.
Mm-hmm.
That's too late. And like you said, the message of lifestyle medicine through a shared medical appointment does not yield well to somebody who spends most of his or her time in the cath labs and the CCU, because there are so many other clinical, procedural, and administrative obligations.
Yes.
At my request, and I had supportive leadership, and they were able to carve out 2 half-a-days a week. And luckily for us at the VA back in 2017, exactly, perfect timing. The VA founded the Department of Whole Health, and Tampa VA was one of the flagship sites. And so I was actually the education champion for the site. So that gave me a little bit of clout to push with, and partner with the dietitians, cardiac rehab people, psychologists, and put a team together and start doing what the VA is to call group medical visits. And one of the founding pioneers of the concept of shared medical appointments, or even recently at the 2024 ACLM meeting, told me that of all the systems that actually paid attention to what he was wanting to do, is the VA was the first one that actually wanted to do it. But no interventional cardiologist has actually done this. It was being done successfully. So we started the program, introductory session, which I call HEAL, Healthy Eating. And it's just a 90-minute presentation. I do it myself. And upon completing that, we would ask the patients and the families, if you see the value in this message, we would like to partner with you, with us. And then the second tier is called the CALM program, CALM, stands for Comprehensive Approach to Lifestyle Medicine. It ran extremely successfully, but at the same time, I also would like to sadly report that it came to a halt as of yesterday. Because of what's going on with the system in general is a little bit of staffing issues, but we haven't killed it. We're going to bring it back. It's my life's mission. We're going to bring it back. But it ran very successfully, and we now have actually compiled an outcomes data set on a spreadsheet. We're going to work on to some published outcomes sometime in the near future. But extremely well received. We get consults on a daily basis, so very well accepted.
Very good. That's great to hear. Now, I'm sure you've heard everyone's talking about this new study that's been out in the news, right? Which is very much getting a lot of attention. The new research that finds that ketogenic diet induced high cholesterol does not predict heart disease. What is your take on that?
Well, I looked at that paper, and I kind of knew that the study was kind of being put together. And then the question I asked was, the hypothesis of the trial would be in defiance of everything that we have established, based off of 200 large trials, 20 million patients, right? 2 million patients with 20 million human years of exposure. To undo that, you need a little bit more than 100 patients. You need a little bit more than a study without a control. You need a little bit more than primary endpoints properly being defined. And despite all of that, if you really look at the granular data at an individual patient level, except for one patient, every one of those patients actually had the most impressive plaque progression ever reported.
So soft plaques, right?
Soft plaques.
Yeah.
To take that information and write a conclusion that it doesn't do that. It just, I'm even questioning, how did that even pass the editorial team to get to even an online preprint? And in terms of, LDL exposure over time increases, plaque burden, and then over time increases, the degree of stenosis and the risk of events, and also the causal link, meaning that LDL-X causes Y, atherosclerosis. The causality, the concept of causality, by textbook definition, has to meet 8 criteria. And when it meets each criteria, there's a level of, support or level of strength of evidence.
Yes.
LDL is one of the only things, or very few things in medicine, that meets all 8 criteria with level of evidence or strength of support ranked as 1. So that's not it's not even an issue, because when I hear these debates about LDL not being causal for atherosclerosis, I'm yet to come across a cardiologist, at least that I practiced and encountered or taught or mentored me, ever have that debate. That's not an issue for discussion. It's just a matter of how do we get it down in as many people as possible. And that's the discussion. That's the debate. But saying that LDL does not cause, it's just not science. It's not supported by it.
Thank you. Thank you for clarifying that for our audience. Now, where do you think with this overall community of academic and clinical cardiology will come together, perhaps to implement this foundational pillars of lifestyle medicine into clinical practice and hopefully train the next generation of cardiologists, just like how you are passionate about lifestyle medicine? Do you see any hope here?
I do. I'll be honest with you. When I first stepped into the lifestyle medicine and dipping my toes into the ocean of knowledge that I was completely oblivious to, and when I started soaking it in, and one of the early frustrations was, how do we get it out? How do we get this out? This is like the mainstream, and it's not. I'm just like a who's stumbling upon this, but it looks like this people have been talking this for close to a century in some form or the other. And I must say, I'm actually humbled by major, at least cardiovascular organizations, inviting, ACLM thought leaders and lifestyle medicine lecturers. And I was pleasantly surprised this past year when the American Society of Preventive Cardiology hosted an entire day titled Lifestyle Medicine's Master Class. Our immediate past president, Beth Freitas, and I were invited to speak and to look at, and what was humbling was that I was given maybe 30 minutes to speak, and in the audience were people, like every slide I'm showing, somebody from that paper is in the audience.
Wow.
So it's like who is who in the world of preventive cardiology came together and gave lifestyle medicine a master class title and invited folks from ACLM. So, and for my kind of a little world that I live in, our University of South Florida, is the only cardiology fellowship in the country as of now, which I started 4 years ago. We have a structured lifestyle medicine curriculum lectures that I give them 6 lectures, 1 hour lecture on each pillar as it relates to cardiovascular disease. And they get that lecture at least 2 times in each year of their fellowship class. And now, people are coming and asking me, hey, how do I get certified in ACLM cardiology fellows? This week, I gave internal medicine noon conference. 3 residents came to me. How do I get to ACLM board certified? Immediately after I get past my internal medicine board certification. So yeah, it's nothing good in life comes easy. This is hard work. And I'm pushing the message like many of you, everybody. And as you have heard me say, it's hard, but the last I checked, only the dead fish go with the flow. And last time I checked, I ain't dead yet. So yeah.
Yes, well, so that's great, and gateway to perhaps close this conversation. I always enjoy talking to you, Koushik, as you know. Your valuable insights and pragmatic approach is what I really love. You sort of simplify message to the point that people can really adopt, even whether it's patients or clinicians. And so thank you for taking the time today and joining us and sharing your wisdom and knowledge. And thank you to our audience for tuning in to this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.